Guys, welcome back to Medical Coding with Blue. Today's episode is all about nurses. Will learning medical billing and coding be easy for you? If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys, so disclaimer first, because anytime I do these type of videos where I'm talking to my nurses, there's always a nurse that gets their feelings hurt. If you get your feelings hurt very easily, this channel is probably not going to be for you, because the way that I explain things is very straightforward. It is very, okay, it's going to be blunt, because to me, we're all adults. There's no reason to go around in circles and try to, Mickey Mouse my way through this, because at the end of the day, when you get in the real world, it's going to show. And I like to make sure that the people are prepared when they go out in the real world, because working with doctors, as you nurses know, is not the easiest thing, okay? Now, you couple that with working with veteran medical coders, and now you've got an even bigger issue, okay? So I want you all to know, I am not questioning anybody's intelligence. That's another thing that I hear from too. Is it, oh, you're questioning my intelligence? No, absolutely not. I am not questioning anybody's intelligence, but I want you guys to know that it's a little bit more complex than a lot of you think. There's a lot of nurses that think that medical coding is easy and that medical coding is just circling from a super bill. And, oh, these are the diagnoses that we use. These are the procedure codes that we use. So, that's coding. No, it is not. Coding is actually interpreting what is written in a way that is reflective of what happened during that visit. And you have to take your nurse hat off when you are looking at these notes, because sometimes nurses, they see things more into the note than what is actually documented. So that's where a lot of that kind of like fine stepping comes into play, okay? So that's first things first. I'm not questioning anybody. I will tell you very bluntly how it is, because that's important for you in the preparation process, especially if you want to pursue medical billing and coding, okay? So that out of the way. The other thing that you have to know is everything that you think that you know about coding, you have to throw it out, because a lot of times it's not what it is. And like I said, some nurses have told me, oh, it's just circling from super bill. I've done that. That's not coding. That is circling from a super bill. That is not what we do. Okay, so the short answer to this question is, will medical billing and coding be easy for nurses? Nurses, LVNs, LPNs, I'm talking to all of you, CNAs, will it be easy for you to learn? The short answer is no. And the reason that I say the short answer is no is because I have been a medical coder since 2008. I have had my YouTube channel since 2018, and I have tutored many, many nurses who have come to me after multiple failures of these exams asking what they did wrong. And sometimes it's just because they don't have the best study schedule set up for themselves, or they have, again, preconceived notions about what medical coding is, and they just try to fly through the material and they don't take the time to learn, okay? So, and after they get done with me, that's when they go on and they're a little bit more successful. So, not to toot my own horn, but I'm just saying that it makes a difference when you understand what this is. The other thing is, well, I'm a nurse, I can skip the medical terminology and anatomy. You could, in theory, you could skip it, and maybe you might be just fine, maybe not. Because as we all know, if you have been a nurse for some number of years, let's just say you've been a OBGYN nurse or mother-baby nurse, and that's all you have seen. Well, your anatomy and medical terminology and everything that you've been using up thus far is going to be on women and children, right? Not on males. So there's a whole nother side. And yes, while you may remember anatomy about males and medical terminology relating to males, it doesn't necessarily mean that you're going to automatically remember when you start studying. So doing yourself a favor and practicing while you are studying medical billing and coding, maybe you're studying on your own. I have my independent study list and syllabus. It's in the description box below. You can study on your own totally. But anywhere you go, there's going to be a variety of conditions that are being seen. And it's not just limited to, okay, well, I work in mother baby, so I'm only going to, work on these kind of diagnoses and these kind of medical terminologies. You could be put anywhere when you are starting off as a brand new medical coder. And because of this, you have to be prepared for anything. If you go to a family practice clinic, for example, as your first job, you're going to see everything. You're going to see colds, you're going to see sprains and fractures, and just regular well child, well baby, well woman visits. So you're going to see a lot of different things. You're going to see a variety if you started in the family practice, or if you started in the ER, you're certainly going to see a lot of variety there as well. Strokes, heart attacks, and that kind of thing. So you have to be able to remind yourself of anatomy and medical terminology. There's no shame in it. Having to go back and just review it, it's a good refresher. Again, especially if you've been in the same sort of specialty for many years, it's good to get that refresher back in your memory, because if you don't use it, you lose it. And so you want to make sure that you are refreshing your memory, and this will only help you in the long run. Now, the other thing is, when it comes to learning the actual coding, it's not just about looking up the codes, it's about understanding the coding guidelines. So if you are skipping the coding guidelines because you don't think that that's necessary, it's another downfall of being a nurse turned medical coder, is because you think, oh, well, it's just coding. No, we have rules that we must follow when it comes to selecting codes. And there's a sequence that these codes are to be in, to be proper, and to make it past the billing and to be able to be paid. Because if they are not sequenced in the appropriate order, they are not, it's going to be a denied claim. So you want to make sure that you are reading the coding guidelines. And I recommend reading the ICD-10-CM coding guidelines in their entirety once per week. It will take you maybe a couple days, sometimes 2-3 days, when you are reading them, because it's so much. In the book, in the ICD-10-CM manual, it is about 35 pages or so, 36 pages, something like that. But if you go to CMS, cms.gov, they have the ICD-10-CM coding guidelines. You can Google this, go into Google and Google ICD-10-CM official coding guidelines 2024, right? Because we're in 2024, and the PDF will pop up, okay? You can listen to it from there if you choose to. If you're using the Edge browser, it will let you. All you have to do is click on a word, and it will come up with the ellipses, the little 3 dots, and then it'll say read it aloud, and that's how you read it aloud, okay? I don't want to hear the question. That's why I'm saying it now. So you can listen to the guidelines, or you can read the guidelines, but it's important that you review those guidelines, because coders that know the guidelines are the coders that are the most successful. If you don't know the guidelines, and when I say know the guidelines, know where to find the answers to it, and you have read it so much that it is familiar to you. You don't want to memorize it. You just want to get through it so that way you know exactly where to go, and it will be able to recall in your mind a lot easier, okay? Because these guidelines get updated every single year, so there's no point in memorizing them, but you do have to have a strong grasp of them. Whatever medical coding certification exam you're going to go after, whether it is the CCS, which is the gold standard of medical coding credentials, the CCA, Certified Coding Associate, the CCSP, that's a Certified Coding Specialist, physician-based, and that is all outpatient for that particular credential. The CCA and the CCS include both inpatient and outpatient coding. And so it's a part of all of those. If you're going with AAPC instead and you're sitting for the CPC exam, it's also included on that, some guidelines, the guidelines questions. So, and they're not specifically written like, what is this guideline? No, it's not like that, but it's incorporated somehow in all of those exams, okay? If you look at the domains for those exams, you'll see that the guidelines is part of it, because it is what we have to know, okay? So that is very important to learning it. As I mentioned, you can study on your own. You do not have to go through a formal program to be able to sit for one of the medical coding certifications, all right? If you are just wanting to pursue medical coding, that is what I recommend. You can study on your own. You can go to the association websites. the American Health Information Management Association. If you go to their website and you go to the AHIMA store, it will have the coding course bundle. It will also have the courses a la carte. If you choose the bundle, it will give you 365 days from the date of purchase to complete all of the courses in there. There's 13 courses total. These are all slide decks. It is not a live instructor-led or anything like that, okay? So that's just what you have to know. If you're very independent in your learning and, you know, that's okay with you, then that's a good thing, right? But that is really the only one that I can recommend. AAPC also has their online medical coding program, and they do have it for like the CPC, where they're prepping you for the outpatient side only. The AHIMA course preps you for the inpatient and outpatient so that you are ready for any exam that they offer when it comes to medical coding. But with AAPC, they do have instructor-led and they do have self-paced. The instructor-led is $600 more than the self-paced course. And both programs run about the same, so a little under $5,000 for each. Again, give or take, but it's a little under $5,000. But AAPC does have this instructor-led one. I cannot recommend the instructor-led because I don't know the instructors. There's a lot of different instructors, and I've heard from my audience many different views on their feedback when it comes to the instructor. Some said that it was the best thing they could have ever done because they had a really great instructor, and others say that it took them a month to hear back from their instructor when they emailed a question. So that's, I mean, it's a coin toss, whichever one you want to do, all right? But please don't ask me about specific schools because I haven't been to these schools, and I will never recommend something that I don't know personally, all right? So that's one of those things. HC Pro is one that I can recommend though, because I did go through 2 of their courses. I went through the course for the inpatient coding. I did their boot camp, and a boot camp is 60 days. And the great thing about their boot camps is it's self-paced, but it's only 60 days that you have access to that information, and you're having to go through it. It really did, for me on the inpatient side, it did fill in some of the holes in my own learning from the time that I had been instructed. When we were going through the changeover, I was going through ICD-10 PCS classes, and a lot of it didn't make sense to me back in 2015. So I was just like, So when I took these courses through HC Pro in 2021, it did help to kind of fill in those gaps. And when I kind of really sat down with it, I was like, okay, this makes more sense. I took that course as well as the CDI course, Clinical Documentation Integrity course. Again, another fantastic course. However, I will say about that CDI course, it is intense, and it is modeled after the ACTIS model, the Association for Clinical Documentation Integrity Specialists. That is the gold standard of CDI. It is actually one of the best that you can ever go through, but that is a very rigorous 60 days. So I did go through that one. Again, they're a little pricey, but it's worth it if that's what you want to pursue. Now, I will say this also about CDI. Do not get into this if you're a nurse and you have not even been a medical coder yet. It is very disheartening when I see nurses automatically want to jump from nursing to CDI when you have no clue about the coding. It is very important to understand the coding because the CDI is a liaison between the coders and the providers, essentially, and they are also an educator. Now, if you as a CDI nurse do not understand coding, and the coder comes to you and says, we have this issue with the documentation, and you dismiss them because you don't understand and you don't think that it's important, that's where that breakdown in communication comes into play. And then what really are you doing there if you're not helping the provider to improve their documentation according to what the coders need as far as like essential information, right? Those details that really do specify what happened during that visit, okay? It's very important that you understand. And I don't know why some nurses think it's like, oh, it's just, they don't need to learn coding in order to be a CDI. The industry standard doesn't require that. But I will say that just because you can does not mean that you should. The most successful CDI nurses are the ones that do understand the coding and that have that grasp of like, okay, these are the guidelines, this is why, and this is what the coders need. So that when you are talking to the doctor about it, or the provider, whether it's nurse practitioner or PA, whatever, when you are talking to them, you are speaking to them as an advocate for those coders, okay? Because while it's not there, it is there, right? There's that element that is needed. Now, nurses are in a wonderful position because they have a built-in relationship with providers already that coders have to work hard to build. And so it's a natural thing for providers and nurses to have this relationship automatically because, oh yeah, well, you're a nurse and that kind of thing. With coders have to work hard, and they do have to be able to be even more detailed because, they have to work to get that respect as well. So that's just something that you do have an advantage when it comes to getting into CDI because you are a nurse. However, that's not everything. You do have to understand coding. And I will always say that. It doesn't matter what the standard is. I'm telling you as somebody that has seen successful nurse CDIs versus unsuccessful nurse CDIs who still think that they are doing the facility and the organization a favor, and when really they're not. And so that becomes a waste of funds, and that becomes a waste of a position, really, when that nurse CDI does not understand coding. So it is always going to be my fervent wish that nurse CDIs start in coding first so that you understand the fundamentals. And just know that even though you are a nurse and you're coming in with lots of education that is focused on nursing, okay? Now we need to see when you go over to the coding side, and you can be just as successful, if not more so, okay? But when you go over to that coding side, you have to take that nurse hat off, all right? You're not always going to be able to select diagnosis based on, oh, well, these are the labs, so this is what the patient has. If the provider did not document it, it did not happen. And that's what you have to remember. And that's where most nurses struggle, is because they can see it, which is why they would make good CDIs, because a CDI is going to look for those documentation holes, because the doctor doesn't always know, because they think, okay, in their brainy sense, they think, oh yeah, it's there. That's just common sense. I've been told that several times. Bleu, that's just common sense. Not when it's not documented, no. Not when it's not clear, no. That's not common sense, okay? So that's just what I will have to say about that. But like I said, being humble and humbling yourself to say, you know what, this is something that is new, and even though I'm coming in as a nurse, it doesn't make me more qualified to be a coder or more qualified to be a CDI just because I'm a nurse. There's training that you have, there's an understanding that you have, but at the same time, you have to grow on those skills with the coding. So that's my advice. And the other thing about it is you have to put in just as much time as somebody who is a brand new civilian with no background in medical at all. You have to put in 20 hours per week. It doesn't matter if you have a full-time job. It doesn't matter if you want to get into this and be successful and really know what you're talking about when you get in there. You do need to spend the time to learn it. And not just assume because you are a nurse that you're going to know it right off the bat. I've been asked that. I've been asked, oh, well, I'm a nurse. Is it going to be easy for me to get a job? No, it's actually not going to be easy for you to get a job, because when it comes to getting into health information, they are going to look at experience. And even though you're a nurse, they're going to say, okay, this person's going to want even more money because they're a nurse. And that's another thing too. I have a wonderful nurse who used my my study template. They used my independent study. They got all the books. They studied on their own. She sat and passed the CCS exam, again, the gold standard of medical coding credentials. She took a position that was a pay cut for her, but she looked at it as training. Paid training, okay? And she started in that with the coding and stuff. And so she worked her way up, and within 2 years, she was a full-fledged CDI. She's a CDI now, and now she's making even more money than she was making when she was a nurse. So it is possible, but she was humble enough to say, you know, okay, I've had this experience as a nurse, and you know, I'm going to take a step back so that I can take steps forward. And she did that, and so it's a glimmer of hope when I see that, and I love that for her. I love that she is successful now and she's doing what she wants to do. But again, I've seen a lot of nurses say, oh, no, that entry-level pay is just too low for me. Okay, well, when you started off as a nurse, you didn't start off on the high end of the pay scale either, did you? So that's another thing that you have to think about, is that you had to work your way up to get to that pay that you're at. It's the same thing when you're going to start into a new field, is that you have to start from a little bit less than what you're used to making, and just a few steps back for a short amount of time is going to help propel you forward once you start making that, once you start getting that experience, and then you'll start making better money, you know, like than when you, of course, when you started. So don't be discouraged by that. When I see people get immediately discouraged by that and leave nasty comments about it, I just block them, because this is not for you then, if that's what's going to be driving you, because the money is there clearly, because, you know, that nurse found that out really quickly. And 2 years is a very short period of time, rather than sitting there and just looking at the surface and, oh, that's just too low. That's not where you will stay. That is a starting salary. That is not where you will stay. So again, it all depends. There's other factors in it too. Are you looking for entry-level positions and sort of, you know, keeping yourself low that way? Because when you're certified as a medical coder, you can pretty much code anywhere based on which exam you took. If you took an exam that says that you know outpatient coding and you go for an outpatient coding position, well, that means you know outpatient coding. If you took an exam that covers inpatient and outpatient, you can go anywhere, hospitals, doctor's offices, anything. But I will recommend that if you are a nurse turned medical coder, do not work for a private doctor's office, because it's usually the spouse that is doing that, doing the billing and doing the coding and stuff. And so it's usually a lot of politics when you are working for a small doctor's office. So I do recommend working for a hospital, okay, or a bigger organization, nursing home, or, you know, dialysis center, that kind of thing. That would be a little bit more advantageous for you, okay, not so political. All right, so that's just what I'm saying. But you can do it. You can do it if you're a nurse. And when you go to do your resume, make sure that your resume is reflective of the things that would make you more appealing as a coder. For example, if you documented like the vital signs and all of those things, you want to make sure that you put those things down, because you know documentation elements, right? What should be there, and that kind of thing. So you know how to do that. You protected patient information. I don't want to hear that you changed lines. I don't want to hear that you changed bandages and things like that, because that's all a part of being a nurse. But if you tell me that, and if I'm a hiring manager, I'm going to look at you like this person still wants to be a nurse. What are the admin side stuff that you did, that you know HIPAA, that you know the documentation elements, and those kinds of things? Did you do the code selections? If you did, then obviously you can put that down, because doing the code selections is one thing, but it's not coding, okay? So just make that very clear, that you selected the diagnosis of the provider, you know, from their list, list that they have for you. That's what you can put there. So that's the thing, and that way they can understand. And don't harp on the fact that you don't have experience, that this is your first job in coding, all right? Don't harp on that. Make sure that you are, okay, these are the skills I'm coming in with, and I understand pathophysiology because I am a nurse. And there's nothing better than that. That's like catnip to these hiring managers for medical coding, because pathophysiology is the one thing that is very, very important, that is like not even talked about enough in this field, is understanding pathophysiology, because that means you understand the disease process. If you understand the disease process, you are less likely to do incorrect coding because you're not going to pick up symptoms of a disease, right? So there's a lot to it. You know, there's a lot to it than that. But that's just something that I want to share with all of you. But best of luck to you if you are a nurse. This is a great field. Don't let any other, naysayers, talk you out of it. If this is something that you want to do, don't be insisting on what you want. Sometimes you have to take a few steps back in order to move forward. Don't get your head all focused on, oh, I only want to work at home. You need to have time in the facility around other coders. Now, if you are in an area like the East Coast or the West Coast, and they have a space issue, most of those coders are at home, then if that's the only thing you can get, that's the only thing you can get. But don't automatically look for it and expect it, okay? Expect to spend some time with other coders because it will help you, all right? We are all the same at the end of the day when it comes to this, because keep this in mind. There's providers that will never understand coding. It's not because they don't want to, it's because of how complex it is. I'm just saying. So with that said, I'm going to go ahead and wrap this one up. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.